Hello and welcome to Health Professional Radio. My name is Toby Longhurst, and joining me in conversation today is Jordan Vivian. Jordan is a representative of the Australian Medical Students Association and is the co-convener of their upcoming Rural Health Summit. Jordan, welcome to the program.
Thank you, Toby.
Let's start a little bit about who you are. So you're studying medicine. Where are you studying?
So I'm currently studying at the University of New South Wales Albury campus. It's one of our rural clinical schools. I've been here since about February last year, and I've enjoyed my time so much down here in Albury that I've elected to stay and finish out the rest of my degree here.
What is it about Albury that you love?
Well, I guess we complete the first couple of years of our study in Sydney, and me myself personally, I come from a small rural town in the Hunter Valley, and going from a small country town to the big city was great. Lots of opportunities and fun. However, I just found myself sort of craving that sense of home and community, and studying medicine, let alone being in Sydney, it just got a bit chaotic. So moving down to Albury, it was just a breath of fresh air that I kind of needed, and I'm very passionate about wanting to pursue a career in rural medicine. So it's been a fantastic opportunity to sort of pursue that.
What was it that led you towards medicine?
Well, growing up, I was always really, really fascinated with sort of how the body worked and all the intricacies surrounding that. The key driver that kind of pushed me to want to, spend the rest of my working life sort of wanting to be in a position to help people. I experienced a personal health adversity growing up, and being in a rural town, I sort of got to experience firsthand the struggles and challenges that people in those situations face, obviously because rural healthcare in Australia has its own sets of challenges that we need to work towards ensuring equal healthcare for all Australians. And so sort of going through that experience, it really motivated and inspired me to want to pursue a career in rural medicine. And so hopefully I'm able to do that in the future.
If you walked into any primary school, a grade 1 or 2 class, and you ask people what do they want to be when they grow up, I'm sure a lot of people would say, I want to be a doctor.
Yep.
And it sounds like you were fascinated by that too. Now that you're in there doing it, is it what you expected it to be?
Yes and no. I think you sort of go into medicine with one idea of what a doctor is, and I suppose what type of doctor you want to be. But sort of as you get further and further along in your degree, you're sort of faced with some of the realities that surround it. Like when we graduate, we face a whole other set of hurdles of sort of not only getting into a job, but also we need a certain amount of training positions for the areas that we want to work in. And that's, I suppose, another challenge that the rural health workforce in Australia faces. So, yeah, it is interesting. There's a whole host of factors that sort of come into the reality of practicing medicine, I suppose.
And after graduation, what type of medicine would you like to practice? Would you like to be a GP, rural GP? Would you like to specialise and work in hospitals or private practice?
Well, that's been a really tricky question for me at this stage, because I kind of really enjoy all aspects of my study. But I do definitely know that I do want to work in the country. So at this stage, I'm thinking rural journalism, which is fantastic in that it will allow me to sort of practice general practice and emergency care and sort of a few other components of specialist cares in the hospitals as well. So you basically get to do a whole host of different things while servicing rural and remote communities. So I think at this stage that's what I'm going to be aiming for.
What do you see as the major differences between rural medicine and medicine in cities and more populated areas?
Well, I think it comes down to sort of the resources and, not only the physical ones, but the people who make up the health workforces that service those areas. And ultimately that impacts the healthcare that we're able to provide to people. I think, obviously we see a discrepancy between the numbers between sort of metropolitan and rural doctors. Obviously we've got higher concentrated numbers of doctors in the cities, and I think this comes down to sort of when we graduate, we've got to go into certain training positions and pathways, and, that's the time of your life when, for a lot of us, we're sort of meeting partners or settling down with families or establishing friendship networks. And I suppose if that's all happening in those metropolitan centres, it becomes harder and harder to then sort of move away into a rural area after that, once you've established your life, because ultimately you're not going to want to work somewhere where you don't enjoy living. So I think that's it's really important that we're sort of now realising that and developing more sort of training options for junior doctors in rural areas so that we can establish that sooner.
I'm really quite curious. When you were studying, particularly when you were in Sydney, when you speak to your classmates, are many of them wanting to pursue a life in rural medicine, or are they want to stick to the cities?
I guess again that's a yes and no answer for that one. A lot of my friends personally are rural students, and we do have similar ambitions to want to work in those sorts of areas. But you do, I suppose, get people who, for instance, might have grown up in urban centres and might want to just work in those areas. But I think the big thing is sort of what type of medicine you want to do. For example, if, say, I was aiming to become a neurosurgeon, that would be almost impossible to do that purely from a rural, remote location, just because the resources and the people to teach you those skills, they're all urban-based.
Do you think there are any incentives that can be put into medical and health education, not just medical, to entice people to come to rural and regional areas?
I think the biggest incentive is probably working towards helping people realise just how many fantastic opportunities that there actually are in these rural areas. I think more so the issue that we kind of face is sort of there is a negative perception surrounding rural health, like you might not get those opportunities. But I personally have had a fantastic experience since starting to practice, doing my clinical training out in Albury. Last year I was one of 11 students here, and we got to work one-on-one with the doctors and second assist in surgeries and do all sorts of amazing things. Whereas I would hear stories from my colleagues back in Sydney, the staff in the urban busy hospitals just didn't have time for them, or they felt like they missed out on a lot of opportunities. So there's definitely a lot out here, and it's not just the education and training, but also more so the lifestyle, I feel. I feel like rural living gives you the space to sort of have time for yourself as well as your work, which I personally value a lot. So I think it's all about sort of just helping people realise that, working out in rural areas is a fantastic thing.
Well, one way you can do that is to tell people about it, obviously, and which is what the Rural Health Summit is all about in many ways. You're the co-convener of the summit.
Yep, correct.
Give us a little information. When is it? What should we expect from it?
Yeah, so like you mentioned, this year I'm convening the Australian Medical Students Association's Rural Health Summit alongside my colleague Dana Duncan. We're both rural students, and we're a part of the team that organised the conference last year in Wollongong, and we enjoyed the experience so much and saw so much potential in it to move it out to a rural area such as Albury. So we've been working on that, and our aim for the event is to sort of showcase a diverse and dynamic program of leaders in the field of rural medicine, as well as some fantastic local doctors from the Albury community to sort of inspire the people who are attending, to spark some conversations about rural health, and also sort of facilitate networking and also help people realise the many opportunities that are available for them in the rural medical workforce. And so we really hope to sort of inspire and immerse delegates through their time in Albury, not only through sort of our academic program, but we've also got a host of fantastic social events on offer as well that are going to aim to sort of show another side of the rural lifestyle.
Who are some of the speakers? What are some of the topics that you're hoping to highlight in the summit?
So we've got a whole host of different things because we kind of want to, again, the main aim is to showcase the many opportunities. Something that we're really excited about is to have Professor Paul Worley, Australia's first National Rural Health Commissioner, attend and deliver a plenary on sort of further training pathways and our role as students in the future of Australia's rural health workforce. But then we've also got a whole host of other different things. So we've got topics such as farmers' health being delivered by Dr. Jackie Cotton, coming all the way from WA. We've got sexual health, priorities in women's health, medical culture. We've also got some panel discussions and innovative care in rural health. So a whole host of interesting topics that sort of go past what you might traditionally perceive rural health to encompass. And as well, we've also got a range of practical workshops for our delegates, so they'll actually get some hands-on skills that they can then hopefully take with them in their practice in the future.
Well, it sounds like you've got a lot of stuff covered, a lot of academic stuff, a lot of practical workshops, and a little bit of fun and social events as well. What are some of the social events? So
we kind of wanted to show off as much as Albury as we could with our social events. So on the Friday night, on the 28th of September, we're hosting a Welcome to Albury cocktail gala at the Murray Art Museum. This will be a fantastic way for delegates to be welcome to Albury through immersing themselves in the cultural experience that the museum offers, being one of the biggest in the country. So that should be a really great way for our delegates to be able to network with our speakers and sponsors who are attending as well, and hopefully maybe have that conversation that produces a change in the future of rural health. And then on the Saturday night, we're having a boot scooting bush dance at the Kinross Hotel in Albury, and that's a really cool 1800s styled wool shed. So it's going to be a classic rural line dancing night. Think flannel, think hay, think all of our delegates just dancing the night away and relaxing. And then the following morning on the Sunday, we're looking to host a lovely breakfast by the Murray River, just because it's probably one of my favourite spots in Albury, and just it's a great way to sort of just see what's around as well.
Well, it sounds fantastic. Have you been practicing your boot scooting, your line dancing?
I guess people will just have to come to find out about that one.
All right. So we're quickly running out of time, but before we go, give us the dates, and if people want to find out more, where can they find information?
Yeah, so the summit's going to be held across the 28th to the 30th of September in Albury. If people are looking for more information, you can find us on Facebook or Twitter or Instagram. The tag is just AMSA RHS18. Otherwise, we've also got a website. That's just amsaruralhealthsummit.com. And if you go to any of those pages, you'll be able to access all of our information, timetables, and ways to purchase tickets, which close on August the 23rd.
Jordan, thank you so much for joining us today. I've really enjoyed chatting with you, and best of luck for the summit.
Thank you, Toby. It was lovely chatting to you too.
Our pleasure. So if you've just joined us on Health Professional Radio, then you've just missed my conversation with Jordan Vivian about the Australian Medical Students Association's upcoming Rural Health Summit. All is not lost, however, because if you visit our website, hpr.fm, you'll find this interview, along with a full transcript and many more fascinating interviews with health professionals and experts from around the world. You can also find us on Facebook, YouTube, iTunes, SoundCloud, Instagram, and TuneIn Radio. My name is Toby Longhurst, and you've been listening to Health Professional Radio.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.